Hi, my name is Dana. I'm the physician assistant here today, and your name is?
Kristi.
It's great to meet you.
Nice to meet you too.
Welcome to the practice. Because you're new, I just wanted to ask you a few kind of general questions. So how old are you?
I'm 60.
60. Okay. And are you retired? Are you working?
I'm retired, yes.
Retired? Okay. What did you used to do before you retired?
I used to be a mechanic.
A mechanic. Okay. Are you married?
I am.
Do you have children?
No.
No children. Okay. And what is your ethnicity?
White.
All right, Kristi. So can you tell me why you're here today?
I'm having a lot of shortness of breath and I'm coughing a lot.
Shortness of breath and coughing. Okay, when did that start?
It's been going on for a while now. It's just getting a little bit worse.
Getting worse? Have you noticed it getting worse with certain things?
It's just all the time, but it is worse with exercise.
Now, is the shortness of breath and coughing coming together, or?
Yeah, they're both always
So they're
there.
coupled.
Mhm.
Okay. And how long ago did you notice it starting?
Maybe a year or two ago.
A year or two ago.
It's been
Okay.
going on a while, yeah.
So is this the first time you're seeing anyone for this?
I've been getting some respiratory infections, so I've been seeing doctors every once in a while.
Okay. And are you being prescribed medication for that, or?
Yeah, when I would get the respiratory infections, they would treat me for them.
Okay. So do you think over the past 1 to 2 years it's been getting a lot worse?
It's
Okay.
getting worse now.
Do you notice anything that's making it better?
No.
No. Have you tried anything other than the medication for the upper respiratory infections? No. And so previously you've had it for 1 to 2 years now. It's getting worse. Nothing really helps it. You haven't really tried anything. You can't really notice anything. You said the exercise is making it worse, correct?
Yes.
Okay. How often do you exercise?
Not very often, but when I do, it's worse.
Okay. Can you explain the type of exercise that you're doing that will kind of aggravate it?
I try to go on walks every once in a while around my house, a couple times a week.
So around your neighborhood?
Yeah, but
That's
recently
nice.
I haven't really been able to do that
Okay.
because of the cough.
Yeah. Does that upset you that you're not walking as much, or?
A little bit, yeah, just because walking into my house up the stairs and everything, it makes it harder to do that.
Okay. Do you have a lot of stairs in your house?
I just have one flight of stairs. There's like 10 stairs.
Okay. So, do you have any pain in your chest with this, or
Just kind of a tightness.
tightness? So no pain, just tight. Okay. And where, can you point on your body where that tightness kind of occurs?
Right here.
Right in the center of your chest. And does that always happen with the shortness of breath and the coughing?
Just sometimes.
Do you notice that the shortness of breath and coughing are more prevalent at night, in the morning,
I think all times of day.
all the time, and then especially with exercise? Okay. Okay, so I just want to run through to make sure I have all the information. One more question. The coughing, are you producing any mucus with the cough,
No,
or
no.
no? So it's a dry cough?
Yes.
Okay. So you've been having this shortness of breath and coughing for about 1 to 2 years. You've seen other providers for upper respiratory infections, but that's not really helping your symptoms. Sometimes you get this tightness in your chest. You notice that it gets worse with exercise. It's kind of constant all throughout the day. No pain. Walking or exercise makes it worse. Okay, that's good. I'm just going to ask you a few more questions about your cough and shortness of breath. So it's a dry cough. You're not producing any sputum, correct?
Correct.
Okay. How about wheezing? Do you experience any wheezing?
A little bit.
A little?
Mm-hmm.
Okay. Can you tell me a little bit more about that?
It just comes with the shortness of breath sometimes.
Does it come with the pain as well? Or the
Yeah.
tightness?
Mm-hmm.
Okay. So you don't have an inhaler or
No.
Okay. How about with a deep breath? Do you feel pain when you take a deep breath?
It's just tight. It's just hard,
tight?
hard to breathe.
When was your last chest X-ray?
I'm not sure. It's been a while.
Do you have a history of asthma, bronchitis, emphysema?
The bronchitis.
Bronchitis?
Those are the respiratory infections.
Okay. So in the past 6 months, how many upper respiratory infections have you had?
2.
What about pneumonia?
No.
Tuberculosis?
Mm-mm.
No. Okay. All right. So I just want to ask you some more questions to learn more about you. It'll help me kind of see what's going on, how I can treat you the best.
Okay.
So are you on any medications?
No.
How about, do you have any allergies?
Just seasonal allergies.
Seasonal. And what kind of reaction are you getting with the seasonal allergies?
Just itchy eyes, runny nose.
And do you take anything for that?
Allegra.
Does that work for you?
Mm-hmm.
Good. Okay, moving into your past medical history. As a child, did you ever have measles,
No.
mumps,
Mm-mm.
chickenpox,
Nope.
rheumatic fever,
Nope.
scarlet fever, polio,
Mm-mm.
psychiatric disorders? No. Did you have your childhood immunizations, so polio, measles, mumps, rubella,
Mhm.
the flu shot, tetanus,
Yes.
diphtheria, pertussis?
Mhm.
So you're up to date on your immunizations?
Yes.
Great. How about, okay, so moving into your adult history, have you had any surgeries?
No. Not recently.
No surgeries. How about any psychiatric disorders? No, no history.
No.
Do you have a history in your family of hypertension, high cholesterol?
No.
Nope. And you said you have no children, correct?
Correct.
Have you ever been hospitalized?
I had my gallbladder taken out.
Gallbladder. Okay. And
So
when
that was a surgery.
when did that
About that.
happen?
4 years ago.
And how did the surgery go? Were
It
there
went
any
fine.
complications?
Nope.
No. Was it emergency surgery or was it a progressing?
It was progressing.
Progressing, okay. And who was the surgeon's name?
Cold.
And where was this? What hospital did you go to?
General.
Okay. So you did have the gallbladder surgery.
Yes.
No other hospitalizations.
No.
How about any major accidents or injuries, broken bones, nothing of that? Okay. You said you have no children. How about menstruation? When did you have your first period?
12.
And when was your last period?
55.
Okay. So you are menopausal.
Mm-hmm.
Have you been having any complications around that? How's everything been
Everything's
going
been
with that?
fine.
Good?
Mhm.
Okay. When was your last pap smear?
5 months ago.
And do you know the results?
It was negative.
Negative. Any history of sexually transmitted
No.
diseases? No? Okay. Wonderful. Thank you for taking the time to answer all these questions. I know it
Of
can
course.
be a lot. So you said you're all up to date in your vaccines.
Mhm.
How about screening tests? Have you had a colonoscopy?
Yes, last year.
And do you know the results for that?
It was fine as well.
Great. All right. Just give me 1 second here.
Sure.
All right. Great. So I'm going to move into your family history now.
Sure.
So, your mother and father,
Mhm.
did they have any history? So your mother and father and their parents,
Okay.
do they have any history of diabetes,
No.
tuberculosis,
No.
heart disease,
No.
hypertension,
No.
pulmonary disease,
No.
stroke,
Mm-mm.
kidney disease,
No.
cancer?
My grandfather had colon cancer.
Do you know at what age?
60.
And how was his treatment?
It was successful, yeah. he was
Great.
fine.
Wonderful. How about history of migraines,
No.
arthritis,
No.
anemia,
Mm-mm.
epilepsy, any mental illnesses or substance abuse?
No.
No? All right, so moving into more information about you and what you like to do. So, so now that you're retired, tell me something that you really enjoy doing in your free time.
I just like going out. I like going out on walks, so that's upsetting that I can't really do that
Yeah.
anymore. I like to do puzzles.
Yeah, that must be really hard, with the shortness of breath and
Mhm.
everything, and hopefully we can get to the bottom of that. How long have you been retired now?
Last year.
Just a year, okay. Do you miss working at all, or?
Not really. I like having my free time.
Yeah, that's great. Okay, and you said you were a carpenter, correct? Or no, a mechanic. Excuse me,
You're
a
fine.
mechanic. So did you go to special schooling for that?
No, my father was a mechanic, so he taught me.
Okay. Did you take any college courses?
No.
How about, did you graduate from high school?
Yes.
And you said you were married. How long have you been married?
35 years.
And how would you describe that relationship?
It's very good. Happy.
Wonderful. Have you ever felt uncomfortable in your relationship? No.
Mm-mm.
No one has ever made you do anything that made you upset or put you in danger or something you really didn't want to do?
No, nothing like that.
Wonderful. That's great to hear. So you talked a little about where you live. And you like to go walks around your neighborhood. You said you had a few one flight of stairs in
Mhm.
your house. Other than that, do you feel that you can navigate safely in your home and
Yes. Mhm.
smoke detectors in your house?
Yeah.
Great. Do you practice any religions?
No.
No. Do you feel that you have a good support system at home and
Mhm.
family and friends?
Yep, I have a lot of loving family.
That's awesome. Do you get to see them more often now that you're retired?
Yep.
Great. They live close by?
Yes. Yes, we all live within 5 minutes.
Oh, wow, that's awesome. Makes holidays easier, I'm
Oh,
sure.
yeah, definitely.
How's your sleeping? Has that been affected at all by the shortness of breath?
No, that's been okay.
How many hours of sleep do you get a night?
Around 7.
Do you find yourself waking up often in the middle of the night to go to the bathroom?
No.
No. Can you tell me a little bit about your diet?
So I eat 3 meals a day. At breakfast, I usually have oatmeal and coffee. And for lunch, I usually make myself a sandwich. And then dinner varies.
How about your calcium intake?
I have milk at night.
Milk. Any other dairy products like yogurt,
Sometimes I eat yogurt.
cheese?
Yeah, I like cheese.
That's good. How about specifically fruit and vegetables? How many servings a day would you expect? Do you usually get?
I eat vegetables with dinner, probably a serving, and then fruit occasionally as a snack.
Good. That sounds like a pretty well balanced diet. How about fluid intake? So, water, juice.
Water after I drink coffee. I drink
Water.
water all day.
How many ounces do you think you're getting a day?
Maybe 5 glasses.
How about caffeine? So, you said you have the coffee in the morning. Anything else during the day?
That's pretty much it.
How about alcohol consumption in the past?
In the past, when I was younger, I drank every once in a while, but I don't drink anymore.
Not anymore. Is there any reason why you stopped drinking? Or
No, I've just stopped.
just stopped? Okay. How about smoking? Do you smoke?
Yes.
You do smoke. Okay. And how much do you smoke a day?
Like a pack a day right now for
Okay.
the past 5 years, and for 15 years before that, it was 2 packs.
Okay. Have you ever tried to quit smoking?
I did. That's why I went down to 1 pack, but I haven't been able to quit.
Well, that's great that you made that improvement. I mean, going from 2 to 1 is still a really great accomplishment, and you can, if you want to, if you are, feel that that's something you really want is to quit eventually, you're definitely moving in the right direction.
Good, thank you.
Yeah. Do you feel that that is something that maybe we could talk about another time about?
Absolutely.
Maybe, yeah, because being a smoker, that definitely has a great effect on your lungs, and hopefully if the smoking improves, it could potentially improve the shortness of breath and the
Absolutely.
tightness, and then hopefully you could get back to the walking and everything
Yeah,
like that.
that'd be nice.
Yeah. Great. So, other lifestyle habits. So you talked about the walking. Do you do any other type of exercise or?
Not really, no.
No. Okay. Other general safety measures. Do you use a seatbelt when you're in the car?
Yes.
You mentioned you had smoke detectors.
Mhm.
Good. So you're retired now. Do you feel that you're more stressed, less stressed than when you were working? Are there any big stressors in your life right now?
Definitely less stressed. The only big stressor is the shortness of breath. Other than that, everything is fine.
That's good. When you do get stressed, what kind of things do you do to help cope with that?
Go on walks, or I like to watch TV.
Watch TV. What do you like to watch?
Older movies.
Older movies. So you said hobbies, puzzles, walking, anything else that you enjoy doing with your spouse, with your family?
We like to go to the movies together and go out to eat.
So no medications. Have you ever used drugs before?
No.
No. Any medication that wasn't prescribed to you, but you took it anyway?
No.
Any expired medication? No. So I'm gonna ask a little bit more personal questions now.
Okay.
I ask all my patients this, and it's just a general screening. You're a new patient here, so I want to know as much as I can about you to help me with your care.
Sure.
So because violence is so common in people's lives, I know I asked you about if you've ever felt uncomfortable before, but I just want to make sure, has anyone ever hit or slapped or kicked you or done something that you didn't want to do or made you feel uncomfortable, whether that be in a relationship or an intimate relationship or any relationship with anyone you've ever had?
No, nothing like that.
Okay. Well, thank you for telling me. That's good to hear. So now I want to ask you about your sexual history,
Okay.
if you don't mind me asking.
No, that's fine.
Okay. So are you currently sexually active?
Yes.
Okay. With men, women, or both?
Men.
And how long have you been sexually active?
Regularly since I've been married.
Okay. Do you use any kind of protection when you?
Yes.
Okay.
Condoms.
Condoms? All the time, sometimes?
All the time.
All the time. Okay. So sexually active men, only with your spouse?
Yes.
Okay. Use condoms all the time, that's great. And I think that is good with those. Alright, well thank you for answering those questions, that was really helpful.
Of course.
Just give me a minute, I want to just make sure I didn't miss anything.
Sure.
Where were you born?
Pennsylvania. Near Philadelphia.
And are your parents still alive?
No. Both
No.
are deceased.
How about your spouse's parents?
And both of them are deceased. as
Deceased,
well.
okay.
Mhm.
So as a mechanic, can you tell me a little about what you were exposed to in your occupation?
Just a lot of the car exhaust and
Uh-huh.
grease and things like that.
Do you think being around that, when you were working, do you feel that the symptoms of the shortness of breath were worse because you were
Um,
around that, or?
Not really. I think it's
No.
just been pretty much steady. Back then it wasn't as bad. It's gotten a lot worse
Gotten
recently.
worse,
So.
okay. How about any pets? I know you said you had allergies. Do you
Mhm.
have pets in the house?
Yeah, we have 2 dogs.
2 dogs, okay. How long have you had them for?
3 years.
Do you find being around them can worsen these symptoms or not really?
No, not really.
No.
I don't think they have an effect.
Okay. So, no history of kidney disease,
Nope.
COPD,
No history.
heart disease,
Nope.
hepatitis,
Nope.
no allergies other than seasonal, no medications.
I do take Tylenol sometimes, but that's just when I need it.
Occasional.
Headaches.
Sure,
Mhm.
yeah. Alright, so I'm just going to run through some other general questions.
Sure.
So in the past 6 months, it's going to seem like a lot of questions, but
Okay.
it'll definitely help me.
Sure.
So in the past 6 months, have you noticed any changes in your weight?
No.
Any weakness?
Actually, maybe a little bit of weight loss.
Weight loss?
A little bit.
Okay. When did you start noticing that?
Recently with the worsening symptoms.
Are you experiencing change in appetite or?
No. Mm-mm.
Do you feel that you're eating the same amount or yeah?
I think so.
Okay. How many pounds have you lost?
Maybe just a couple.
A couple?
3 or 4.
Okay, how about any weakness, fatigue?
Some fatigue, yes.
Fatigue?
Yeah, fatigue.
Okay, when did that start?
And when the symptoms started getting worse around the same time.
Do you notice anything that kind of heightens the fatigue, making you more tired?
No, just all the time with the
All the
with the
time?
coughing. Yeah.
Do you find yourself napping more? Does that reboost your energy or?
No, it doesn't help.
No. So nothing is really helping with the fatigue.
Yeah.
Okay. Has the fatigue the fatigue is getting worse with
With
the
the other-
shortness of
yeah.
breath, correct? Okay.
Correct.
Have you experienced this before, the fatigue and everything?
No,
or
just with the
just
coughing
with
and
this?
everything.
Okay. All right. And no. Done?
Yep.
Okay.